I'm Dr. Jeff Howard, and like you, I am a Kentucky physician and advocate for our Commonwealth's health and well-being. I also serve as the Commissioner for the Department of Public Health, where I have the unique opportunity to lead policy initiatives and programs to improve the collective health of our state and serve those of you on the front lines of care. One of the things that you learn very quickly in public health is that prevention always is better than cleanup. Everyone benefits, the individual, the healthcare system, and the taxpayer, when we can prevent illness rather than trying to treat health problems and diseases after they strike. This is definitely the case when it comes to dealing with the flu. You see, I grew up in eastern Kentucky in a small community where, for the most part, people only went to the doctor when they were sick. They did not seek preventative care. And since taking this position and meeting people from across the state, I now realize that this is a cultural issue that extends beyond the mountain community where I grew up. I'm sure you hear it all the time too. I don't like needles. I've heard the flu shot actually makes you sick. The vaccine isn't a good match to the strain circulating this season. In this day and time, it is even harder to combat when you have the internet to reinforce any medical conspiracy theories that may exist out there. That is why having the support of the physician community is so important in our efforts to promote the flu vaccine this year. Peer groups or bad information from the internet sway people, but no medical information is more powerful than the kind that comes directly from you. Our doctors and providers are the resources that Kentuckians trust most when it comes to making healthcare decisions. Consider this. Last year, 333 Kentuckians died because of influenza or flu-related illness. That's our friends, our family, our neighbors, and our loved ones. 5 of these deaths were in pediatric patients. Only one of those pediatric patients had significant underlying conditions. It's the same story all across the country. As of the end of September, a total of 181 pediatric deaths have been reported to the Centers for Disease Control during the 2017-2018 flu season. This number exceeds the previously highest estimate of flu-associated deaths in children reported during a regular flu season, which was the 2012-2013 season, which had 171 deaths. Did you know that approximately 80% of flu deaths occurred in children who had not received a flu vaccine? These are staggering and heartbreaking figures to consider, especially given the ready availability of flu vaccine and what we know about the seasonal prevalence of influenza. Flu is extremely common, very serious, and sometimes deadly. So it's time to focus on flu. The healthcare community must do more to ensure Kentuckians are taking the necessary steps to protect themselves, their loved ones, and our society as a whole. Thank you very much.